my name is Matt Brown. I'm a physical therapist, and I'm here to talk to you about physical therapy as pertains to what you're going to go through after your operation. What I'd like to start with is a slide on safety and preparing your home. All of these items have a different application to each person individually, but it's worth investigating each one to see if you can use this information to prepare your home. The ones that I like to highlight, this first one about eliminating clutter, anything that might trip you up when you're using an assistive device to help you get around, like a walker. Now is the time to shore that up before you come home from the operation. The other one I like to mention is this one in the middle. I love my dog, but he likes to be right at my feet, and most pets do like to be at the owner's feet, and they end up being a trip hazard. So something else to just consider. Again, these are all items that are worthwhile to investigate and to consider as you prepare your home for coming home from your operation. When it comes to equipment, I like to really talk about the walker the most, because that's what's going to help you be most mobile. I would recommend getting a walker just like this one with wheels on the front and stoppers on the back. These are pretty easy to come by. Most of them are adjustable for your height with these guys here. And the way to fit a walker, and it's really important to fit a walker before you try to use it, when you stand inside the thing and your arms are comfortably at your sides, the handles ought to hit you at the wrist, just like this. The idea is that when you do put your hands up on the handles, your elbows bend a little bit, but you can still straighten them. This is where you have the strength in your upper body to support your weight when you use a walker. Okay. Next on the list is a shower chair. This is a prototypical shower chair. You don't have to have one of these things, but talking with people that have had these operations, they say they get generally fatigued a lot more quickly after the operation than they did before. So having a place to sit inside your shower is a safety item. We don't want you to fall outside the shower. We definitely don't want you to fall inside the shower. But any plastic chair that fits in your shower that won't rust will likely work. But this is a prototypical shower chair that you might find at a medical supply store. When it comes to toileting, this is the best option for you. Again, adjustable with height. It has arms to push off of that will help you getting down to the toilet seat and back up. These are the best options, but you might not absolutely need one. It's worth practicing getting up and down off your toilet at home before you come to the hospital so that you're prepared. There are other items up on the list, reachers, grabbers, and sock aids. There are items that can make life easy, but I tend not to tell people to run out and buy a bunch of things unless they absolutely need them. A couple of pre-op exercises that I think are certainly worthwhile. Getting up out of a chair is typically a lower extremity task, and if you have one lower extremity that won't be helping you perform this task, having a little extra strength in your arms will come in handy. The next series of exercises, I'd like to talk about each one individually. The first one on the page here, ankle pumps, probably the most important one on the page. It helps with what we call venous return. When you walk, it helps you with your circulation in your leg, but if you're not going to be walking normally on your leg after the operation, it's worth doing a little exercise to maintain the circulation. Quadriceps, the quadriceps muscle is the muscle on the top of the thigh. It helps us extend the knee or straighten the knee. It's a real important muscle in helping us get up out of chairs and go up steps, and it tends to go dormant after the operation, so it's worth activating this muscle to wake it up. The more you exercise it, the sooner it'll wake up after the surgery. It's just a signal exercise, a signal coming from your brain to the muscle to tell it to turn on and then tell it to turn off. And then when it comes to actually directly mobilizing the knee, flexion is bending as opposed to extension, which is straightening. You can slide your foot in and out while you're sitting in a chair like this, or you can slide your foot in and out while you're lying down like this. You can see now it says pre and post-operative exercises. These are going to be the first ones that you do after the surgery as well. And then one more kind of indirect exercise. Your gluteal muscles are the muscles in the back of your hips that help us get out of chairs. And again, these are important muscles to wake back up after the operation. So again, a signal exercise. Turn them on, turn them off, turn them on, turn them off. I'd like to talk about this for a minute. One thing that I've noticed in my time being a physical therapist is a lot of people after their operation struggle getting their leg straight more than they struggle getting their leg to bend. And we don't know exactly why that happens. We used to think it was because everyone did this, and I've never had my knee operated on, but I guarantee you will want to do this. This will feel good for you to have a little pillow under your knee with it bent a little bit. But you can see we put a big don't sign there. because that's something that will contribute to your inability to fully straighten your knee. Not that we want you sitting like this with your leg all the way straight all of the time, but it's worthwhile to spend some time within the first days and first weeks of your operation working on getting your leg all the way straight, even if it's just for a few minutes every few hours. Going up and down stairs, most of the time people that have a bad knee that are going to have it operated on, they employ this strategy. And when it says up with the good and down with the bad, that just tells you which leg goes first when you're going upstairs. When you go up steps, you bring your good leg up and it pulls you up one step at a time. And on the way down, your bad leg goes first so that your good leg does the work to lower you down one step at a time. That won't change after the operation. You'll still want to go up with your good and down with your bad for a certain period of time. It won't be like that forever, but for the first few weeks to few months, that'll be how you're going to manage stairs. You can see Todd here has his hand on a railing and a cane. Those are also helpful. Human beings also are very helpful. What doesn't work on stairs, walkers, don't even try to use a walker on stairs. There's no really good way to use them. So use your sequencing, up with your good, down with your bad. Use your a cane and a railing, and you'll be able to manage just fine. When it comes to sitting and standing, I can demonstrate for you the best way to do this. What you want to do, the most important thing is you got to get yourself to the front of the surface that you're sitting on. The second thing, have the surgery leg out in front, extended out in front of you. There's two reasons to have that. The first reason is because your knee might not want to bend as much as the unaffected side. It might, but it probably won't. The other reason is weight bearing. If that foot is way out in front of you, it can't bear any of your weight when you go to stand up. So you have the walker in front of you. You're pushing off the surface that you're sitting on. Your good leg is doing all the work. You don't do anything with your operative leg, and as you stand, it just kind of slides in towards you, and then you can put up your hands up on the walker. When you go to sit back down, it's just the opposite. Get your leg out in front, even if you have to help it and get out in front, and then you reach for the surface that you're sitting down to, and you lower yourself down. That leg is out in front, so it won't bend as much as you sit, and it won't bear as much of your weight. You'll notice that I did not do this to help me get up. You don't want to use the walker to help you actually stand because it's unsteady. You want to push off the surface that you're sitting on, and if your chair has arms, that's even better. But then as you stand, then you put your hands upon the walker. It's a walker, it's meant to help you walk. That begs the question where you're going to sit when you go home. Couches, love seats, and sofas, they tend to be nice and soft and cushy for your tushy, but they tend to be difficult to get out of unless you have real long arms, which most of us don't. This is actually a picture of a chair that we have in the hospital rooms. Not that you're going to spend a whole lot of time in a hospital room, but there's a reason that we pick chairs like this. They got a nice, firm, supportive surface that can be built up with blankets and towels, not pillows. Pillows squish. They have a nice, firm, high back, and they have arms to push off of. So any kind of chair that will mimic this type of chair is the chair that you're going to want to try to sit in preferentially when you go home, if you have a chair that's like that. When it comes to shower and tub, it's difficult to talk, to everyone's situation. Everyone has a different situation in their bathroom. Here's a couple of situations. This gal here backed up with her walker, got over her threshold, and sat down in her shower chair. And then Todd here has a shower tub combo that he needs to sit and swing his leg around. The main idea is to get you to think about your particular situation and how you're going to get yourself in and out of your shower or tub safely. And if you have questions, write it down and bring those questions with you so that when I see you or another physical therapist or an occupational therapist sees you, you can ask those questions and we can usually talk you through how to manage that situation at home. Toileting, I kind of mentioned that already. This is probably the best device if you absolutely need something like that. But that's really the magical question is, do you need something like this? And I just showed you how to get up and down from a seat. The best way to find out and determine that is to go home and practice getting up and down off your toilet seat. And if you can do it before the operation, then you'll be able to do it afterwards. And if you think you're going to have trouble, then maybe you investigate getting a device like this. Dressing, I kind of mentioned, there's all sorts of kind of gadgets and gizmos out there that can make life easy. You got reachers and grabbers and sock aids and long handle shoehorns. Again, if you have a coach that can help you with those things for the first few days to first few weeks, I tend not to tell people to run out and buy a bunch of items. They exist because sometimes it's difficult to address the foot, and they have their place, but it won't be long before you'll be able to manage these things. Just know that these items are available if you think you're going to have some difficulty. Vehicle transfers. This is an important thing to consider and think about as you prepare, because we want to be able to wheel you out after your operation, and you're not going to go, oh, now what do I do, right? So there's a lot of things that we can talk about with this picture. Did Todd scoot the seat all the way back so that he has enough room to clear his foot? Because you can see that's quite a bit of bend in the knee. Also, there's a lot of variability in which kind of a vehicle that you're going to be going home in. Is it a real low car that might be easy to get in but might be difficult to get out? Is it a real high truck that you might need a step stool to get in? Also, there have been times when I've suggested to people that it might be better to get in the back seat on the driver's side instead of the front seat on the passenger side, depending on the vehicle and which knee they had operated on. It tends to work better if you're going to get in on the passenger side if you had your right leg operated on. Not that it has to be that way, but it tends to be easier if it's the last one in and the first one out. It tends to lend itself to easier transfers in and out of vehicles. The main idea with this slide is that I can show you all sorts of great exercises to do right after your operation. We went over those already. But if you don't do any of those things and you do one thing, get up and walk at least one time per hour. Don't go too far, don't fall down. But 5 minutes at the most per hour is what doctor likes to limit people to, just because it's not only good for your leg, it's good for your heart, your lungs, your bowels, all those things. It's good to just get up and mobilize. Don't get stuck in your chair for hours and hours at a time. Again, my name is Matt Brown. I'm a physical therapist. I appreciate your time and attention today. I hope this was helpful.